So Sandy and Wayne, there are a couple of things. One, you didn't need a piano.
I didn't need it. Hold this for me.
And the other thing is, one of the rules of public speaking, never follow a youth choir that can sing like that.
I was thinking the same thing.
I'm Dr. Kevin Churchwell. I'm president and COO here at Boston Children's, and I've got the honor of introducing my great friend, Wayne Riley, to you. Dr. Wayne Joseph Riley currently serves as the president of the State University of New York, SUNY, Health Science Center at Brooklyn Downstate Medical Center, where he began his tenure in April of 2017. Just a little bit about Downstate. Downstate is the largest of 4 academic health science centers among the 64 campus SUNY system. The institution is composed of the College of Medicine, School of Graduate Studies, College of Nursing, College of Health-Related Professions, School of Public Health, and the 300-bed University Hospital of Brooklyn. Additionally, the Downstate affiliated entities include the University Physicians of Brooklyn, a biotechnology incubator, and a campus foundation with assets in excess of $150 million. Wayne, you're a busy man.
Very busy.
Prior to Dr. Riley's appointment as president of Downstate, he completed a 2-year term, that's in 2014 to 16, as the 91st president and president-elect of the 144,000-member American College of Physicians. The ACP was founded in 1915 and is the nation's largest medical specialty society, representing internal medicine and subspecialties. Prior to that, Dr. Riley, from 2007 to 2013, served as the 10th president and chief executive officer of Meharry Medical College in Nashville, Tennessee. Meharry, founded in 1876, is the nation's largest private, independent, historically Black academic health center dedicated to educating health professionals, researchers. The school is composed of the School of Medicine, Dentistry, Graduate Studies, and Research, with approximately 980 professional students, 350 faculty, and 1,000 employees. I've got a list of your other positions, Wayne, but we only have an hour and a half, so I'm going to cut it out a little bit. But I'll mention a few. Dr. Riley is a member of the National Academy of Medicine. He's an adjunct professor of health policy at Vanderbilt University School of Medicine. He's the former chair, National Advisory Council on Minority Health and Health Disparities for the NIH, board member of the YMCA of Greater New York, board member of the Bedford-Stuyvesant Restoration Corporation. And there are others, but I'll stop there if that's okay. Most importantly, Dr. Riley is married to Charlene Dewey, who's Assistant Dean for Educator Development in the Office of Health Science Education, Professor of Medical Education and Internal Medicine at Vanderbilt University School of Medicine. They are the proud parents of 2 daughters, 19-year-old Erin and 15-year-old Alexis. Wayne, given your experience and incredible distinguished career, I think you will bring us a perspective about what Martin Luther King Day means for us in healthcare, but also as citizens of this country. Wayne is a great friend, and I'm very excited he's here today to bring a message to us. And so I present to you Dr. Wayne Riley.
Well, good morning. What a great day to be here at Boston Children's Hospital to play a role in observing the wonderful life of Dr. Martin Luther King Jr. I want to thank the CEO of this illustrious place, outstanding Sandy Fenwick, for what she has done for this great institution under her very able and passionate and visionary leadership. Congratulations, Sandy, for a job well done here. Want to thank, again, my dear friend, Dr. Churchwell, and his lovely wife, Gloria, here. They're dear friends of the Riley family and the Churchwells. And I'm just so delighted that he's right with you, Sandy, leading this great organization. So thank you for this wonderful honor, Kevin. I want to thank Reggie. I want to thank Carol, the chairman of the committee. Where's Carol? I know there she is. She's made it all possible. Thank you very much for the work that you and the committee put in. And I also want to, students, you may look at people like us and say, people like Riley and Churchwell and Ms. Fenwick, nobody ever helped them, right? That's not true. we have a lot of people who helped us get to where we are trying to get to. So just like you have your teachers and Ms. Lee, I have great heroes that I look up to, and two are here today. The first is Dr. Augustus White, Professor Emeritus of Orthopedic Surgery at Harvard Medical School, former Chief of Orthopedics at Beth Israel. Gus is a leader in American medical education, dear friend. So Gus, thank you for being here. Thank you. Next is another dear friend who came with Dr. White, and that's Dr. Harris Gibson, one of the pioneering Black cardiothoracic surgeons in this nation, in this community. Dr. Gibson was on the staff of Winchester Hospital, which is now, I think, affiliated with Lay Clinic. He's been a professor of surgery at BU and at Tufts. And during my tenure as President Meharry, I was able to honor him for his great work as a distinguished graduate, 1961 graduate of Meharry Medical College. Dr. Gibson, please stand. Now, students, one of the things that I want you to understand about Dr. King, we tend to look at Dr. King, in statues and in pictures. And I was about your age when he was killed. I remember that night very well as a youngster, the night he was killed in April of 1968. But, we shouldn't, and Dr. King would not want us to dwell on his death. He would want to talk about his life. And for young kids, just a little tidbit that I thought you'd find interesting. The night before he died, he was at the Lorraine Hotel in Memphis, Tennessee. And kids, guess what he was doing? Don't go home and do this now. He was having a pillow fight with his fellow ministers in Memphis. And Andrew Young told me this story, Ambassador Young, who was with him when he died, said, yeah, Martin was such a fun-loving guy. He loved life, he loved to joke. He said that night he was in a great mood. He walked in, he started swinging pillows at us. And then within 48 hours, he was dead, kids. But that's how much life this great man had. And so that's why I'm so glad you're here to hear about some of his work and hear his words, because 50 years later, they still make a difference. And had he not died, he'd be about 90 years old. If he had lived, his father had lived into his 80s, so it would have been an expectation that Martin Jr. would have lived into his 80s, maybe his 90s. So he was taken from us way too early. But in spite of all the struggles that he had to deal with, Dr. King was very passionate about a number of things. And one of them was issues of social justice. And if you think about his life and you look at the pictures of his famous civil rights activities, this is one of my favorite pictures. It's the Selma to Montgomery voting rights march in March 9th, 1965. And he's locked arm in arm with other ministers and John Lewis on the right, Ralph David Abernathy on the left, two of his closest friends, and they were marching so that folks can get the right to vote, because the right to vote was not ensured back in the 40s, 50s, and 60s for many Americans, particularly Black Americans. But these pictures remind us that he also felt passionate about healthcare. And if you ask me, what is the Kingian philosophy of healthcare that we at Boston Children's Hospital or Downstate or in the medicine, nursing, or whatever health profession you're in, is this simple quote that he has been attributed to him in many ways. And it says, of all the forms of inequality, injustice in healthcare is the most shocking and inhuman. Now, the interesting thing about that inhuman thing, sometimes it's written as inhumane. But those who were there remember Dr. King saying it was inhuman. That's even worse than being inhumane. So again, this encapsulates his philosophy about healthcare and why we have to do our daily best, whether you're a doctor, nurse, physical therapist, researcher, to try to make the health of all much better. Now, Dr. King himself had an experience with our healthcare system. It was September 20th, 1958. He was at a book signing in Harlem, in New York City. He was signing books, autographing books that he was well known to write and to publish. And a young lady stabbed him with a letter opener. The letter opener went in the left side of his chest, and Harris Gibson will recall this. The letter opener was touching his aorta. That's the large blood vessel in the middle of our body that supplies blood from the heart everywhere. And that letter opener was like this on his aorta. And so for the rest of his life, he would always joke, I was a sneeze away from death, because had he sneezed, that letter opener would have punctured his aorta, right, Harris? And he would not have lived a few more years. But when he was hospitalized, they were asking him, how do you feel about the woman who stabbed you? And this is the way he responded. He felt no ill will towards Mrs. Isola Curry, that was the woman who stabbed him, and know that thoughtful people will do all in their power to see that she gets the help she apparently needs if she is to become a free and constructive member of society. Think about that, colleagues. The woman had just stabbed him. He had undergone a major operation, 10 to 15 days in Harlem Hospital. And that was his response. Get help to this lady. She needs the help. And in this case, mental help. She had a mental condition that led her to stab Dr. King. And here he is with his mother and his wife convalescing at Harlem Hospital. So Dr. King understood healthcare, not only from his own personal experience, but also that healthcare was one of the remaining civil rights, in addition to voting rights and housing rights and employment, that we needed to have the nation embrace. Now, again, 1960s, Dr. King was also very aware that African-American physicians were not routinely integrated into many organizations. And here you have a group of Black physicians who are picketing at the American Medical Association convention in 1963. We as African-American physicians take for granted that we can join any organization we want nowadays. Back in the 60s, that wasn't so. And so Dr. King was in close contact with a group of physicians who were trying to make sure that the houses and organizations that have healthcare professionals are inclusive of African-American physicians and other minority health professionals. So he took, again, his role to catalyze addressing healthcare very seriously. And I don't think gets enough credit for it based on a lot of his activities. Now, you remember, I entitled this talk, What Would Martin Think About Health Disparity and Health Inequity? And I've had the opportunity to talk to many folks who worked side by side with him. And even after his death, they would meet, they'd say, what would Martin think about this? What would Martin do about this? Well, that's why I've phrased entitled this talk, What Would Martin Think About Health Disparity and Inequity? Because I think he'd have a lot to say. And the reason why is this. If you think about health disparities, these are the sobering statistics as I refer to them. Infant mortality rates for Black babies are 2.1 times higher than for whites. The life expectancy for Black women is about 3 to 5 years less than other populations. That rates of death attributable to heart disease, stroke, prostate cancer, breast cancer are higher in African-American populations. That diabetes is 2 times higher in Blacks and Native Americans compared to other citizens of this country. And that minorities remain grossly underrepresented in the health profession workforce relative to their proportions in the population. So again, Dr. King would be sort of reminding us about these disparities. He'd even go further. He said, look, he would say that a child born in Mississippi today could never expect to reach the 75th birthday. Think about that. A kid born today is likely not to get to their 75th birthday compared to a child born in California, New York, or Hawaii, who could easily approach 80s. Here again in Boston, kids, Dr. King studied in Boston. He lived here. He walked the same streets that you do here in Boston when you're visiting with your family. He got his PhD from Boston University. He loves Boston. He met his wife here, met Mrs. King here in Boston. But he would be stunned and chagrined and quite upset that here in Boston, that the life expectancy of a citizen in Back Bay has a much longer life expectancy than a citizen who resides in Roxbury or Jamaica Plain. And you could see that if you live in Back Bay, you could live to almost 90. If you live in Jamaica Plain, you get close to 80, but you don't get to 90. And if you live in Roxbury, you barely get to 60 years of age in terms of life disparity. So again, Dr. King would be acutely aware of even the conditions here in his former hometown of Boston, where he spent so much time. It was so formative to his experience later on in life. Now, again, even if you look at children's health, and this is an outstanding, world-renowned children's hospital, known the world over. Any of you who have traveled overseas and you say, I work at Boston Children's, they knew exactly where you work and how impactful this great institution is. But we still have gaps in terms of children's health care. Gaps in outcomes between Black, Hispanics, and white kids are a problem too. Dr. King would not be happy about this, kids. Black kids were between 38 and 95% more likely to die of 9 cancers. Among 6 cancers, Hispanic kids were 31 to 65% at greater risk of dying compared to white children. So Dr. King cared deeply about youth and children. And again, just in terms of what you do in this great institution, he would remind you, we still have significant gaps, colleagues, in terms of how we take care of kids and make sure that kids get all the care they need when they need it. Again, Dr. King would remind us socioeconomic status plays a large part in this, that even for one particular type of blood cancer, acute lymphoblastic leukemia, 44% of the difference in survival, whether that kid lives, is due to the socioeconomic status, or what we now refer to as the social determinants of health. So again, he'd remind us, this is important. He'd want all of us engaged in this conversation to really focus on improving the care of kids across the board, no matter where you live. Again, obesity. National Institute of Diabetes and Kidney Disease says that for non-Hispanic Black kids between 6 and 11, rate of obesity is 22% for girls, 21% for males. Among African Americans between 12 and 19, the obesity rates are 24% for girls and 21%. So he'd remind us that we've got to get our communities to eat better. Now, this was a man who grew up in the Deep South with a typical Southern diet, and he would know the struggles that it takes to get healthier food options to America's families. But he would, I'm sure, implore us to address the obesity problem and to make kids healthier by making sure they eat better. Again, Dr. King would remind us that racism is indeed literally bad for your health. Discrimination is a type of stressful life experience that has negative effects on health across the board, lead to more heart disease. Pregnant women have higher levels of difficulty during their pregnancies. Racial differences in the quality of care that persist for African Americans, irrespective of whether you have insurance or not, whether you have Blue Cross, Blue Shield, United, whatever, there's still issues. Irrespective of job status, whether you work, whether you have degrees. And he would say, look, we've got to address this, that it's not just the socioeconomics, but it is also other aspects that we would need to really focus in as a nation to make sure that everybody gets a good shot at life. African-American women are 4 times more likely to die in pregnancy and childbirth. Again, a huge issue across this country, maternal mortality, and how we're going to address the gaps, perceived, real, otherwise, about the care that Black women who are having babies are experiencing with the healthcare system. Everybody knows who this is, right, kids? This is Serena Williams. Well, remember, Serena Williams almost died after she had her baby. And she has talked about how she felt dismissed by healthcare professionals, that she felt disconnected from us. And here is a woman, a multimillionaire, world known, and she felt like she didn't get good quality care and almost died as a result of having blood clots. So again, if it can happen to Serena Williams, it can happen to any Black woman in the country. So again, 4 times more likely to die in pregnancy and childbirth, regardless of socioeconomic status or how many degrees you have. This is a problem, colleagues, that Dr. King would say, look, this is tied to the productivity of the nation. We have to get better maternal care to all communities, particularly minority communities. Again, looking at children, infant mortality is still a huge problem. 11 per 1,000 births versus 5 in 1,000 births for non-Hispanic whites. Dr. King would again implore us, we've got to do better, colleagues, at this. The future of the country and the world are children. And we've got to make sure that we do a better job of making sure that children can do well. Now, Dr. King would be amused by what I just showed up on screen here, but he'd also say, look, this is how serious the problem is. Here we have the famous medical journal, the National Geographic, a couple months ago had a story I couldn't believe it. They had a story. National Geographic had a story about why giving birth in the US is surprisingly deadly. And it focused on the fact that Black mothers are particularly at risk and that basic, better prenatal care could make a difference. The National Geographic, he would say, my gosh, if the National Geographic is covering this issue, we've got to do better. So I know Dr. King would be quite chagrined about this in terms of a clear and present health danger that we have to address. So again, having a baby should not be a life-threatening event. And again, the statistics I've already told you, but just let's compare ourselves to the rest of the world. Among 46 nations, there were only 2 that have been reported to have worsened maternal death rates: Serbia and the United States of America. Only out of 46 nations, only 2 have shown declines in maternal death rates. And that's unfortunately our great country and Serbia in Eastern Europe. And more to the point, Dr. King would say, look, 60% of the deaths of mothers are preventable. He would remind us, this is preventable, colleagues. We have to get to work. So giving birth in the US can be deadly, unfortunately. And again, which American women are dying? Black women, almost 50 per 100,000 compared to others. It's huge. The age, 35 to 44. The diseases, the top diseases that tend to cause maternal death, cardiovascular, endocrine, blood disorders and infections and hemorrhage and problems with the heart. So he would say, look, we need some focused attention. He'd be particularly concerned about the fact that women are not getting good prenatal care. Women with no care are only in the 3rd trimester. Native American women, Black women get less, and Hispanic women get less prenatal care than compared to other women in the population. And he would be aghast at a country as rich as this, as well organized as this, with such great facilities, doesn't do a better job of getting prenatal care to women. So he said, why are Black mothers still dying, colleagues? Even relatively well-off women are dying. And here was a story in the NPR had a young woman who passed away. That's her picture on the wall, and that's her mother taking care of her baby. She had a master's degree. She had a 6-figure job. She went to all her prenatal visits, and she still had a unfortunate health outcome in terms of the birth of her child and ultimately her demise. So again, this is a complex problem. Dr. King would not sugarcoat this, colleagues. He said, look, it's multifactorial, it's complex, but we got to do better. Black mothers are 49% more likely to deliver prematurely than their white counterparts. Income and education are not protected. Income and education are not protected. Even Black mothers of higher socioeconomic status who live in predominantly white neighborhoods saw the worst outcomes in terms of low birth weight babies, almost 15%. So again, he'd remind us, this is complex. We need to do better as a nation, he would implore us, and particularly those of us in healthcare. So Dr. King would say that health disparities, number one, pose a significant moral and ethical dilemma for the country. He'd remind us that healthcare as a resource is tied to social justice, to opportunity and quality of life for all Americans, not just minority Americans. That it's tied to the productivity of the nation, that if we don't have healthy populations, we can't grow communities and have great schools and a great economy and great places to live if we don't get a handle on this health disparity problem that we have. The inadequate or poor care further exacerbates healthcare costs. And that obviously all of this has clear implications for the quality of care all Americans get, not just minority Americans, but all Americans. So lots of quotes from Dr. King. This is one that I saw scrolling earlier. But Dr. King's right. He would say, look, the time is always right to do what is right. And to do what is right in terms of healthcare is incredibly important for all of us who care deeply about the care of patients and communities. And so he'd remind us, keep doing the right thing. It's always appropriate to do the right thing in terms of taking care of patients. Now, I know Dr. King would be beside himself if he had lived during the presidency of the 44th president of the United States. Something he could never have imagined. Many of us in this room could never have imagined it. But he would be so laudatory of President Obama for what President Obama did in terms of the Affordable Care Act. The Affordable Care Act has made a difference in the health of the country. It's under assault right now with the current government in Washington. But again, the Affordable Care Act, he would remind us, represents the US system's most significant regulatory overhaul since 1965 and the establishment of Medicare and Medicaid. That the Affordable Care Act has provided insurance and decreased the number of people who do not have insurance. And that between 2010 and 2015, the uninsured rate dropped almost 10%. That, he would say, is progress. That is progress away from disparity. So again, the uninsured rates have dropped precipitously. Dr. King would be over the moon about this. He'd be absolutely over the moon in terms of the lower of the gap between those who have insurance and those who don't. Because he knew that getting health care and getting insurance access was incredibly important to improve the health of the minority community, particularly in the Deep South. He was around when the debates about Medicare and Medicaid were going on. And he was aware that the Southern senators, some were in opposition to Medicare because they saw it as a way to give better care to minority populations in the Deep South. So he was well aware of the politics of healthcare during his lifetime, but he would be over the moon at the progress we've gotten because of the leadership of President Obama during his 8 years in office to expand health insurance to the nation. And if you look at the nation pre-Affordable Care Act, and then you look at it more recently, so in 2013, kids, the purple means that's where there wasn't enough insurance for people. And then look at 2016, you see more gray, that means insurance is expanding. That expansion of insurance happened because of the Affordable Care Act. Now, I tell you, he would be livid at the fact that the Deep South where he was from, lags the rest of the country in terms of levels of insurance. He would just be beside himself about that. His own state of Georgia, his former state of Alabama, my home state of Louisiana, where he spent a lot of time, where his organization was founded. You could run your finger from the District of Columbia line all the way to West Texas. And that's where you have big gaps in insurance because of politics and a very nihilistic approach to providing health insurance for Americans. So he would take this graph and he'd show it everywhere he went in terms of why the Affordable Care Act is important and why it should be embraced in the southern part of the country of which he was from. Now, he would also be a little bit concerned about the fate of minority health professionals. More minority representation is needed in the health workforce. So kids, if you want to be a doctor, a nurse, a pharmacist, therapist, dentist, social worker, occupational therapist, these are great careers. And I know your school's going to expose you to some of those careers because you can have a wonderful life, make a great living, and really serve other people. Remember, Dr. King was about service, but we need more. He would remind us that we just have 4% of the nation's physicians are Black. Guess what it was in 1963? It was 3%. He would remind us, my gosh, we haven't made much progress at all since the 1960s. And so again, this was a study that came out, got a lot of airplay by G. Collada and her group, published in the New York Times. It said, the secret to keeping Black men healthy is maybe more Black doctors. Okay, so what's the evidence? The evidence is this. 63% of Black men assigned to Black physician agreed to a diabetes screening. 43% of Black men assigned to a doctor who was white or Asian agreed to the diabetes screening. A gap. 62% of men assigned to a Black doctor agreed to cholesterol tests. 36% of Black men assigned to a doctor who is white or Asian agreed to cholesterol tests. So again, there's a gap. And that this was the evidence he would cite to say, look, we need to do better in terms of making sure that all healthcare professionals are more sensitive to dealing with minority population. But he'd say this is a clear signal we need more Black professionals to work hand in hand with everybody to improve the care of the nation. And so he'd remind us that we have to have a diverse healthcare workforce. Again, 4% of the population, 4% of all physicians are African American. That he would be, again, quite disappointed that over 50 years we've not made much progress in terms of that. Look at enrollment in medical schools. Only 7% of enrollment at all the nation's medical schools were either Black or Latino. Where again, if you look at the population, the demographic changes, he would say, look, we've got to do better to diversify medical education to make sure that we have more Black and Latino physicians and more Black and Latino physicians serving communities in need. So again, he'd remind his colleagues, it's hard. It's hard. Everything he did was hard. Dr. King never had an easy day in terms of his work in civil rights. And he'd remind us that the arc of the moral universe is long, but it bends over time towards justice. One of his most famous quotes. And think about the power of this quote in terms of what we do on a daily basis to either teach, care for patients, counsel patients, prepare their medicines, whatever we do in the healthcare workforce. Dr. King would say, look, keep bending that arc to improve the health of the nation, to improve all of us. And again, he'd remind us that his life was not in vain, that he would have loved to have lived a long life, but he had a higher purpose. And that higher purpose is to continue every year, every day, to encourage us to do better in terms of addressing our great nation's health problems. And I know this great institution, this Harvard Medical School, leads. And so if there's anything I can do to underscore this great day, this wonderful honor you've given me, is to tell you, Dr. King would say, go back to work. Thank you very much.